I thought this was an interesting study. It was a cohort study. It took about 1,000 patients who had bought direct-consumer personal genomics testing kits from two companies, 23andMe and Pathways. And then they followed these people out to see really what they did with their genomics results. About 60% of the people said that they intended to talk to their doctors about it. In fact, interestingly enough, after 6 months, only about, I think, 20 or 30% had actually talked to their doctors. When they asked them the reason for that, most of the people either said that they didn't think that a conversation with their doctor would be worthwhile, or they just didn't have time to do it.
Direct-to-consumer genetic testing really is kind of a Pandora's box. And there are lots of issues associated and lots of problems associated with the direct-to-consumer testing. I think there is some, valid results that I think that patients could use. I think especially with regard to pharmacogenetics and maybe getting test results about medicines that may be helpful or may be harmful or cause adverse effects for that individual. I think that that information could be especially effective.
What I found interesting about the study just personally was that I've always felt that these tests, we don't really know what to do with them right now. It's a situation where the technology has really gotten ahead of the data, and in this case, maybe the market has gotten ahead of the technology, which has gotten ahead of the data. And so people generally found that when they presented the pharmacogenomics data, that physicians didn't really use it very much, and when they presented the risk data, physicians also didn't really know much of what to do with that.
I think there are going to be a subset of patients who are going to be satisfied with their interactions with their PCPs, and another subset of patients who are going to be less than satisfied with their interactions with their PCPs. And I think those who are less satisfied, I think probably the characteristics of the PCPs with those interactions are the PCPs felt like the information that they got from the genetic testing wasn't of high value, wasn't of high utility. And part of that may be, part of that reason for that opinion may be the FDA questioning the validity and the safety of some of the studies that come from, or the study results that come from direct-to-consumer testing. Secondly, I think many of the PCPs who are getting these test results may either not have confidence or feel like they don't have training in interpreting these test results. So as a result of that, they may not feel comfortable giving patients advice with regard to changes they can make in their lifestyle to help prevent these diseases from occurring in the future. And then lastly is just the time constraint. These test results are very difficult to interpret at times and will take a long time, a long period of discussion to go over them. Many of these, most visits in the physician's office are only 15 minutes long.